Hi, I'm Becky, DPT, and today I want to talk with you about, could it be a tight piriformis? Piriformis syndrome happens when your muscle right here along the hip ends up getting tight. If that muscle gets tight, all of us are made just a little bit differently. So if that muscle gets tight, that muscle or your sciatic nerve either runs under it or through it. If it runs through and that muscle becomes tight, it pinches down on that nerve, causing some irritation, causing some symptoms, maybe down the hip, deep pain in the hip, down into that calf, or even down into the foot. It can be pain. It can be nerve pain, so you can get that sharp shooting pain. It could also be numbness and tingling, almost like your foot's asleep and you have to pound it to try to get rid of that feeling. It can also cause weakness in a leg. I've seen that piriformis even cause some muscle atrophy. Your nerve is the battery power to your muscle. So if that battery is not powerful and working like it should, then your muscle is not provided with what it needs, so it can't function at its full capacity. So deep pain in the hip, shooting down the leg. A lot of times we even think when that pain and that numbness goes into our leg that we may have a disc problem. I would recommend, if you're having these symptoms, that you see your doctor and be evaluated, because they may decide to do further testing. Also, in physical therapy, we can do some different tests to see if that piriformis is tight. One of those tests is the FAIR test, which I'm going to show you today. To perform the FAIR test, we would be lying on our side. We would flex that hip. We would adduct that hip, letting that knee fall down towards the mat. And then in turn, we go into that internal rotation. If there's pain here or it increases that numbness, that would be a positive FAIR test, which then would say you would benefit from some stretching and some strengthening exercises. So our first stretching exercise would be to bring the knee up to the chest. So here, I'm going to bring my left knee up to the chest, and I'm going to bring that left knee over and up towards my right shoulder. So it's just bringing that knee to that opposite shoulder. And you're just going to hold. A good 30 to 60 seconds is very beneficial. If you have a tight piriformis muscle, it's always very beneficial to also do that opposite leg. Because everyone that I've seen for a tight piriformis muscle, it's never just one-sided. That other one ends up creeping up at a later time. Another stretch for us to do would be to cross our ankle over the knee and pull that leg up through and just hold. And you can rock side to side as you're holding that stretch. And of course, both sides, at least 30 seconds for that hold. Another way to do that same stretch, we could be seated in a chair. I'm on a ball today, so it's going to be a little bit more rocky. But on a straight back chair, you can cross that ankle over top and you can push down into that hip and just hold. And again, that's going to increase that pain, but we just need to hang on to it. And once you release that stretch, that's when that pain subsides, because it's releasing and taking that pressure off that really tight muscle that's pinching down on that nerve. So the first strengthening exercise that we can do for our piriformis is bridging. So we just lay on our back, bend our knees up, push the weight through the heels, and you're just going to lift the hips and lower down. Lift the hips and lower down. For strengthening exercises, I recommend 30 repetitions in a row. And if you need to, you can do 3 sets of 10 to build up to that 30 in a row. 30 in a row repetition increases your strength so that you can tolerate walking, getting up from a chair, in those different activities. So you want to build up that muscle endurance along with that strength. So another way that I like to strengthen the piriformis is I'll have my clients lift up, feet together, knees together, and then I let the knees fall out to the side, hips down, and come up and pull those knees together. That is eccentrically contracting that piriformis muscle. As we pull the knees in together, you are lengthening that muscle and strengthening. The next exercise we're going to do are side leg lifts. Not only does this help strengthen that piriformis muscle, but it also helps strengthen your gluteus medius and gluteus minimus. And those muscles are almost always weak. Our third strengthening exercise is clamshells. You're going to keep the hips stacked and you're just going to lift that knee up. You want to make sure you don't roll back. You stay nice and tight in that core and you just lift. So the last exercise that I have for improving that piriformis muscle is lying down on your belly, and you're going to extend that leg, locking out that knee, keeping it nice and straight, and lifting. And of course, as we've discussed, you want to make sure everything that you do on one side, you do on that opposite side. So another option for that piriformis is a foam roller. And you can roll back and forth, making sure to hit that muscle group. Sometimes our muscles end up forming small adhesions, which are just little abnormal pieces of tissue, which is just like scar tissue. So to work that out, it can be very painful, but a foam roller is very beneficial. For the stretching exercises, we want to make sure that we hold each exercise for 30 seconds at least. If you can hold it for that full 60 seconds, that's the most beneficial. And each stretch should be done 3 times on each side. For any of the strengthening exercises, they should be done 30 repetitions in a row. So once we have become strong enough and comfortable with the exercises, 30 reps right in a row. If we do this once a day, this should help that piriformis. Have a good day.